Hi, my name is Marta Zinyuk, and this is my video reflection. The materials during this week have taught me important concepts that I can use in the future as an acute care nurse practitioner. As I read the material assigned this week, I was surprised by ideas that were conveyed in the reading. The first concept I was surprised about was the common occurrence of congenital disorders and the concepts in reference to the inheritance of autosomal recessive, autosomal dominant, and X-linked recessive disorders. It was interesting to learn the different disorders and their classifications. I was extremely surprised that 1 in 200 live births have single gene disorders such as color blindness, cystic fibrosis, or Marfan syndrome. I was also surprised to learn that an X-linked disorder, such as Fragile X syndrome, is the most common cause of mental retardation, cognitive deficit, and learning disorders in the United States. And 1 in 4,000 boys are affected, while 1 in every 8,000 girls are identified with this disorder. Three things I learned about mental disorders. According to adult prevalence of mental illness data, 18.57 of adults are experiencing a mental health illness, which is 45 million Americans. The three things I learned about mental disorders are that 1, schizophrenia causes the following changes in the brain: reduced gray matter in the temporal lobe, enlarged third and lateral ventricles, abnormal cells in the hippocampus, excessive dopamine secretion, and decreased blood flow to the frontal lobes. The second thing I learned was that depression is a mood disorder with a genetic component to depression. And the causes include decreased activity by norepinephrine and serotonin in the brain. Third thing I learned was that panic disorder is characterized by the following: palpitations, tachycardia, hyperventilation, sweating, sensations of choking, and nausea and vomiting. In addition, feelings of terror. The three things that I learned in reference to substance abuse disorders are: 1, substance abuse deaths occur more commonly than motor vehicle accidents in the United States, which is really surprising. In fact, in 2009, there were close to 40,000 drug deaths, according to statistics. The second thing I learned is that the cause of substance abuse is related to heredity, genetics, family practices, in addition to stress. And the third concept that I learned in reference to substance abuse disorders is that common manifestations of withdrawal are irritability, tremors, nausea, vomiting, stomach cramps, high blood pressure, and psychotic episodes. In addition, these can be accompanied with convulsions. How I will be able to apply what I learned in my future practice. I will be able to implement what I have learned in my role as a future acute care nurse practitioner in the management of the critically ill. Understanding the manifestations and characteristics of mental disorders, substance abuse disorder, and/or genetic disorders will assist me in appropriate diagnosis and treatment. For example, substance abuse disorders place individuals at risk for detrimental consequences such as respiratory depression and seizures. And understanding the management and appropriate diagnosis is extremely important in the acute care environment. Thank you for listening to my reflection.